Wonderful. Thanks for coming on to the podcast, Dr. Feingold.
Of course.
It's a pleasure to be in New York, and it's great to actually meet you.
Yes.
So this is a good time. And so you're a second-year psychiatry resident.
That's right.
I know you're going to be a great psychiatrist because you know how I know that?
Tell me.
Because upon meeting you, I only met you like 20 minutes ago. The first thing you did was ask me about me, which I think is a great start to any clinician who works in the healthcare space, and especially like with mental health and stuff like that.
Totally. Well, I appreciate that. And yes, however I can be helpful for you today.
Sure. I don't know that we're going to psychoanalyze me specifically, but you came out with a book recently that I wanted to talk to you about, which actually brought me here.
Yeah.
Thanks to Dr. Scott for bringing us together. You guys are co-authors on the book.
Yeah.
It's called Choose Growth.
That's right.
So I want to talk to you about that. I read the book. I think the book is great. And I have some questions because you're the clinician and you have all the answers.
Definitely don't have all the answers, but I'm happy to take a gander. And I'm glad that you read the book. And it will be coming out for popular press for folks to buy in the United States on September 13th, 2022. And it will be made available in the UK as well and all over the world. So hopefully listeners will be excited.
Very cool. Yeah, thank you for the advanced copy.
Yeah.
So your book is about choosing growth. Can you tell me what that means and why you decided to write about choosing growth?
Sure. So the title comes from a quote by Abraham Maslow that asserts that one can continue to, and I'm paraphrasing, but move backward towards safety and find comfort, or we can choose a path of growth, and that's a choice. And it's about committing to the fact that we are in control of a lot more things than we often think that we are. There are many things that we can't control, the houses or families we're born into, the genetic lottery that we are endowed with, and simultaneously there are a lot of choices we can make that can deeply influence the outcomes of our lives. And choosing growth is acknowledging what's within our control, what isn't, and how do we make choices in line with what serves us, and acknowledging we're going to make mistakes sometimes, but that ultimately time and life only moves in one direction, and we have a say in what that looks like for us.
I think that's like an incredibly optimistic message. And just from talking with you like off camera, I can tell you have a very optimistic outlook on things. But I think it's more than just your like disposition towards life. I'm sure you're a very happy person. But in the book, you talk about, we're coming out of a pretty tumultuous time that's unique in that it's affected everybody in the sense that we've all gone through like some universal trauma, if you will. But you're optimistic about that. Why?
So none of us have been unscathed. And I think the pandemic represents a time, and Scott and I talk a lot about this, where no matter really what any individual circumstances are, we've all experienced something that's challenged us in various ways. And one optimistic thing about this time, as destructive and as catastrophic as it has been for so many people, is that I think it has normalized the fact that so many people are suffering. And
in what ways?
I think we've been challenged in isolation, in solitude, and understanding large-scale loss. So many challenges that we were each facing before have been sort of compressed and magnified for the masses. And I think that helps us see common humanity, or gives us an opportunity or a window to see common humanity in other humans.
Do you see that in your clinical practice? I mean, you're now rotating and you're seeing patients and all of that. So do you see sort of the effects of the last 2 years in your patients?
Yeah, in all sorts of ways. I think early on, when the pandemic was first starting, I think a lot of psych patients were not presenting. A lot of medical patients were not presenting. They were staying home because coming into the hospital was threatening and scary, and everyone was being told to stay home.
Yeah.
And as time has progressed, we've seen a lot of folks who are presenting after not having gotten care for a long time. So we're seeing more acute patients, lots of, suicidal ideation, not just in adults, also in children. We're seeing a lot of teenagers present to our emergency room seeking care. a lot of people looking for psychopharmacology and having a hard time finding doctors because so many mental health professionals are just booked for months and months. So we're really seeing a lot of sequelae of folks who are thankfully realizing that they need the help, but have not been getting it for quite some time.
Yeah, I to your point, in the beginning of the pandemic, I worked at a hospital in Toronto, and you only saw the most critical patients, and none of them were really mental health patients. They were all just people, late stages of life, like those types of really extreme cases. But everyone was just like scared to be, in the place where illness is concentrated. Mm-hmm. And I think you're seeing the effects of that. One of the things that I gathered from your book, so you're describing sort of the really extreme end of what that trauma can look like, suicidal ideation, and these really extreme mental health byproducts of the last 2 years, and sort of being so detached. But you kind of make this argument that trauma is unique to everybody, in that just because something's traumatic to you, it doesn't necessarily mean it'll be traumatic to someone else. And you kind of get to this place where you identify something called you call it the post-traumatic growth. Mm-hmm. And you say this is something that we can all aim at. So do you mind describing what that is?
Sure. So this is not a concept that we came up with by any means. Post-traumatic growth comes from two psychologists who wrote about this, I believe in the late 90s, Tedeschi and Calhoun, who talk about when traumatic events happen, and the caveat, as you described, is that I don't know that there's any event that is in itself traumatic. What makes an event traumatic is there are potentially traumatic events, and the way that a person processes the event with the resources they have access to, the environments they have, the social support they have access to, is what makes that event traumatic. It's the event and the individual and sort of the environment that they're in.
Okay.
And we all have the potential not just to bounce necessarily back to baseline after traumas, but to perhaps get to a place where we would not have gotten to in the absence of trauma. So post-traumatic growth talks about when something happens that is potentially traumatic and seismically shifts our worldview, that in the process of reconstructing our worldview in the wake of that traumatic event, we can have a new appreciation of life, identify new possibilities that we didn't have access to before, use strengths in new ways. So we're not suggesting that we're necessarily better off in the wake of trauma than we would have been in the absence of trauma, but that trauma can actually catalyze new opportunities to grow that help us connect more deeply with others and ourselves.
Yeah. I think the terminology, it might sound really scientific, but I think everyone can kind of relate to that, right? Everyone's gone through things, and hopefully have come out better people from going through things. I'm just curious clinically. So you said there's no true way to categorize trauma, but clinically, how would you look at trauma? How would you identify it?
Yeah. So folks would argue that there are ways of saying whether something is traumatic, so criterion A trauma is something that's defined in the Diagnostic and Statistical Manual, which is like our psychiatric Bible.
Right.
So in order for someone to qualify for a diagnosis of post-traumatic stress disorder, for example, according to the DSM, there has to be some traumatic event that causes it's real or imagined fear, profound sort of fear of death or loss of life.
Right.
And that is one way of defining something that's traumatic. But like you said, and as I argue, for certain events might cause that for one person and not cause that for another person. Mm-hmm. So I'm not here to police what is traumatic for one person and not traumatic for another person, or for me to say what could cause real or, the threat of real or imagined death for someone.
Yeah.
I fully believe that it's in the eye of the beholder, of who experiences something that's, and how their nervous system is activated in a way that leads to changes that causes them to be perpetually in flight or fight mode, or disengage from other from loved ones or other folks that causes detrimental effects to their mental health that they can't just immediately bounce back from.
Right. Yeah, I think almost like an objective criterion is kind of secondary to like the subjective experience, right? If fearful of like a looming death, it's, doesn't really make any sense from an objective standpoint, but it keeps them up at night every night persistently. Like I would say that's pretty traumatic. Regardless of the class of trauma, you kind of give us strategies that you outline in your book that are pretty optimistic in the sense that if you trend along the path towards self-actualization and transcendence, we can sort of overcome our traumas and become better people. So I feel like that's a buzzword now, self-actualization, and even like newer than that, like transcendence. So do you mind defining what self-actualization means? And then maybe you can get to transcendence. I feel like that's the higher one after that.
Sure. So self-actualization is often depicted sort of at the top of Maslow's pyramid. So Many listeners or viewers may have heard of Abraham Maslow's hierarchy of needs.
Yeah, if you study psychology, you have to have heard of them.
Yeah, and most of us have seen it actually depicted as a pyramid.
Right.
So my co-author, Scott Barry Kaufman, in his last book, Transcend, The New Science of Self-Actualization, he talks about how Maslow never actually depicted a pyramid for the hierarchy of needs, which is why we offer a different model called the sailboat, which we can certainly talk about. And at the top of the pyramid that is normally depicted by Maslow is self-actualization, this ability to live our lives with purpose and meaning and authenticity, and not just have our basic survival needs met of safety, security, and self-esteem and connection, but to really be able to align the way we live our life with a larger value set and to do what gives us a sense of joy and meaning and purpose. It's to have an integrated self, to live our lives in the way that we would ideally live our lives. And what we talk about, and Maslow wrote about this, and he had many, many definitions of transcendence. There wasn't a single one. But what we talk about in the book is living in a way that is authentically integrating our own needs with the synergy of society and the world around us. So being able to have an integrated sense of self that's not just about doing what we want to do in the world, but going beyond that and doing also what the world needs of us and how we can uplift the communities and the people around us too.
That sounds fantastic. I think listeners, and just like myself talking to you, like if I could get to a point in life where I felt like I was fulfilling my individual purpose and that was somehow benefiting, the broader community, I don't know what more you could ask for.
And it's not something that we ever just wake up one day and we'll always say, I've reached transcendence today. Yeah. It's really about the process of living life. It's less of an outcome and more of a process that we are constantly working towards and constantly integrating. And we say, like, life is not a video game where we unlock the next level of life and hear some voice. In my head, it's Scott's voice saying, you have unlocked level transcend. So it's really about being in the world and harmoniously integrating the lessons that we learn through all of the experiences we have in life.
I think that's tough, especially for someone like me, because I'm looking like measurable. Okay, can I write it down? Can I point to it? Can I put a number to it? Mm-hmm. And maybe you can to a degree. Like I helped this many people. I provided this outcome, sure. But I think what you're talking about is something a little bit higher than that. It's beyond metrics.
So I think what you're talking about is very important. So we all have goals for ourselves, right? And when it comes to setting goals, one of the things I think is really important is to know, like, is this measurable? I love the SMART goals acronym. I don't know if you've heard of that, but goals that we can actually set ourselves up for success they're SMART, they're specific. So how do I know if I'm reaching this goal? They're measurable. We have to know, are we doing this or not? They're achievable. They're within the realm of possibility. They're relevant to our larger value set, and they're timely. So we have to know, like, when we set out to reach this goal, at what point am I going to evaluate and reevaluate and adjust my goal as needed? So I think we can set goals for ourselves that meet those specifications, that are measurable. We have metrics to define whether or not we're working toward them. And it's when I see transcendence and self-actualization as being in the process of working toward my goals.
I see.
Integrating and iterating on all of the things that bring us that sense of purpose that we're working toward, that are part of our larger value system. So I think you're right in saying that transcendence is almost like a higher order process that's not simply reducible to checking off a box of meeting a single goal.
That's a good way of putting it. I think a lot of times we can think our purpose is up here. And as a clinician, you write about how the mind and the body are connected. And so can you explain like how the mind is reflected in the body and how your body kind of works up backwards to like influence your thinking?
Yeah, of course. So this is something I don't think we talk about nearly enough in medicine.
Yeah.
At all. And so I think for this audience in particular, it's very important that we reintegrate the mind and the body. Mm-hmm. It's almost absent from modern Western allopathic medical practice,
right,
with a few notable exceptions, which we can talk about and sort of goes beyond choose growth. But so the mind and the body are inextricably linked. And that wisdom goes back to ancient philosophers and even Hippocrates, who is cited as saying, if you're in a bad mood, go for a walk. And if you're still in a bad mood, go for another walk. So Hippocrates, the father of medicine, of modern medicine, was able to see, hundreds of years ago that even a solution for helping our mood was something that is somatic, taking a walk. So René Descartes, the 17th century philosopher, really, in service of enabling bodies to be anatomically dissected and to perform surgery, he basically made the argument that the soul is something that is not physical. So the mind and the body are separate entities. Mm-hmm. And that really set us up on a path, for example, to have psychiatry and neurology, which operate in the same organ, but are two totally different disciplines in Western medicine. The psychiatry deals with matters of the mind, and neurology deals with matters of the brain. And what a false separation. And I hope that in my career, in my lifetime, we can reintegrate these disciplines. So common and very intuitive examples that folks can understand about the mind-body relationship is feeling butterflies in your stomach when you're anxious about something.
Right.
Or when someone is having like an extreme form of anxiety, a panic attack, how that is a very physical experience. Heart starts racing, sweat. People literally feel this rising sense of impending doom, that their life is in danger. And really, it's an hyperactivation of the nervous system. But it comes from anxiety, and it's a psychological process. So those are some examples of how we feel mental experiences in our bodies. Mm-hmm. One of my areas of expertise that I'm fascinated by is the disorders of gut-brain interaction, and actually the 33 adult and 20 pediatric disorders that have no histological, cellular-based pathological etiology, but are just dysfunction in the way our bodies function and operate. So irritable bowel syndrome, for example. Mm-hmm. There's nothing that I could test on an endoscopy or do a biopsy to say, oh, this person has irritable bowel syndrome. It's a constellation of symptoms. It's illness, the experience of illness without any observable disease. And I think that's many of we don't have advanced tools enough yet in psychiatry and these disorders of gut-brain interaction to pinpoint, oh, this is exactly what's going on. Yeah. This is the disease process. Instead, we have people who are suffering and have illness. And I think when we say, oh, this is all in your head, this isn't real, we totally invalidate and undermine the experience of patients who are have very legitimate suffering. So anyway, that was a very long-winded way of saying the mind and the body are totally linked. We see it I see so many patients coming to the medical emergency room with grief reactions. They're not eating. They think something is physically wrong with their body, which it is. And the underlying cause is, oh, I lost my son a year ago and I haven't felt the same since.
And it manifests in the body in that way.
Absolutely. Absolutely. Inflammation is a big driver of many physical disorders, as well as depression and anxiety and chronic stress. So in the GI world, the gastroenterology world, where I spend a lot of time, even patients who have very real, quote unquote, inflammatory illnesses, such as inflammatory bowel disease, there's a huge comorbidity with mental illness. And it's a bi-directional relationship, that the lived experience of having illness is very distressing and can cause mental illness. And the experience of stress and anxiety can increase inflammation in the body, which can set off exacerbations of physical illness. So there's a huge comorbidity between inflammatory bowel disease and many mental illnesses, as well as substance use that people use to cope with the pain that they have. And what's so interesting in this population, where there is very observable illness, is that often patients experience the highest levels of distress and pain and symptoms, not when their disease is most active. So if you actually did an endoscopy in someone who has symptomatic Crohn's disease, for example, they may actually be in clinical remission, but they still experience debilitating symptoms. And that's probably mediated by the brain-gut, the brain-body connection.
Wow. I think that spiel is so important in validating people's experience, because a lot of people who may be experiencing these things, they might want to go to a clinician and get like a diagnosis for something that's not mental health. But I think if that message could be propagated further, the idea that like stress and anxiety manifest in the body in those ways that are not measurable or you can't test for, I think that would be a really good message to get out there.
And to help doctors feel more confident, saying, we've ruled out all of this scary stuff. And just because you don't have cancer, you don't have this, you're not bleeding internally. And you're still suffering. Perhaps we should look at what's going on in your life outside of these symptoms and what might be correlated. Levels of stress, relationship, social support. Usually we have some clues when we look at the person's life more broadly.
I was going to ask you, so how does someone know that they've experienced like a form of trauma that needs to be clinically looked at?
So some signs that someone might be experiencing something are difficulty with basic functions that should, quote unquote, not be something we think a lot about, like eating, sleeping, libido. If someone's like, they had a normal sex drive and something happens in their life and suddenly they have no zest or energy for life and no interest in, their sexual function, that could be a signal that something is going on. Or there's some neurovegetative things like sleeping too much or overeating, or the opposite of that, not eating, not having any appetite, or not being able to fall asleep at night. Intrusive ruminating thoughts. So when you're going about your day-to-day life, seeing things or having thoughts that are coming seemingly out of nowhere that you actually might feel physically or feel like they're intruding on a person's experience. Withdrawing from social connections, things that at one point were not so difficult that become more of an exercise.
Yeah. All right, let's say like I've experienced some form of trauma in childhood or something like that, and I want to overcome that trauma. So let's say I didn't think my parents raised me well, and now I don't want to have children because I don't feel like I'm capable of raising a child because I'm scared of that. So I think the element there is a lot of things. There's like attachment issues and like self-esteem issues there. There's also an element of fear. And you talk about overcoming fear in your book and you give strategies and stuff like that. So how do you get someone to sort of move beyond those limiting beliefs when they come to you with something so so deep, and it's so deep rooted in their lives?
I mean, it's a really big question, and there's no simple answer.
Yeah.
I think the first thing, there's a joke in psychiatry, how many psychiatrists does it take to put in a light bulb? Have you heard that one?
Like this specific iteration of the joke?
Yeah. No. So, just one, but the light bulb has to really want to change, right? So one of the things that I'm confronting as a trainee and a doctor emerging in my career is that, especially when it comes to mental health, we're presented with folks who may be here in the hospital willingly. They may be coming to my office because they need to get evaluated for some medical treatment, or they're being pushed by a family member to get help. You're asking me the question, what do I do if I want to face these traumas and these fears?
Mm-hmm.
The first step is acknowledging that it's something that we want to face and want to grow from and don't want to bog us down for the rest of our lives. So acknowledging that there is some issue or something to address, I think, is the first step in helping someone realize what's going on. And, there are many modalities of psychotherapy, and a lot of people are turning to self-help for solutions to face some of these fears and uncover and unpack some of these traumas that have shaped our worldviews. I think what's so hard about childhood trauma and early life trauma is that they shape our worldviews in such profound ways that we don't even appreciate how certain behaviors or ways of being in the world have been colored by those experiences, because it's all we know. So I think there has to be a deep sense of humility,
right,
of acknowledging that, wow, like I do this, a curiosity and a learning to accept what comes up, because facing those things can be very painful, and it has to, I would recommend that someone unpack and acknowledge these things in the presence of a trained mental health professional,
right,
who they can work with to uncover some of these things, and do so in a supportive environment so that they're not totally unraveling while facing some of these things.
I'm going to push you a bit, because I feel as though a lot of people, when they think of psychiatry and psychology, and they probably don't really even know the distinction they're making there, but they always think like, oh, it's something to do with my childhood, ha ha ha. And it's like a big like cliche when they look at the field as a whole. But what is the merit there between like those early experiences and then how we relate to people as we get older? Like when you look at attachment and then how that shows up in relationships, can you give examples of what that looks like?
So what the research shows about attachment is that there actually isn't a great correlation, but we're not destined to live out the attachment patterns that we necessarily developed as children. And of course, so much of who we are and our sense of identity develops in relation to our caregivers and early in childhood, from infancy, and the way that we felt loved and supported and showed how to get our needs met. So our mental models of the world, in a very basic way, are formed in relation to our caregivers when we are totally dependent as babies and need to be fed and need to be changed. And the way that we engage to get attention from our caregivers, when we got the attention we needed, those patterns get reinforced.
Mm-hmm.
And then those patterns get reinforced in school environments and through adolescence and friendships and with teachers and other relationships in our lives beyond the caregiving relationship. And we have so many social influences that we can learn about relationships from beyond our own families, from media and books.
Right.
And so we're not destined necessarily to just repeat the patterns that we learned in our infancy, but we can appreciate and all learn from reconciling who we are as adults by the time we have this theory of mind to question how we are the way we are with the conditions that we grew up in. I think in some schools of thought and in some forms of psychotherapy, that matters a lot. The developmental experience and why, and the importance of understanding why we are the way we are. There are other schools like CBT, cognitive behavioral therapy, which don't actually deal with that question at all. Why do I have these thinking patterns? It's all about readjusting, understanding why the thoughts I'm having relate to my beliefs about the world and the consequences in the way I behave. But there's nothing in CBT really about unpacking where it comes from or what motherhood trauma we have.
Yeah.
So I think it really depends on what an individual is looking for in terms of what modality and how understanding their childhoods, or whether even to go there, is going to be helpful for them.
I think that's really encouraging for a lot of people, because I feel as though people have a lot of these experiences that they don't get to share, and maybe they have shame and stuff like that. But it's kind of nice that the literature says that we're not bounded by those experiences. I'm sure it depends on the degree of trauma you face and how you've internalized it and all that stuff. But like you're saying, when you get to the age where you have this theory of mind about yourself and you can sort of evaluate yourself, you can take the past and transform yourself to become the person that you want to be. I want to shift the conversation towards self-esteem.
Mm-hmm.
So I feel as though, especially as a young adult, people have this hard time gathering an identity and forming a healthy self-esteem, because they're always comparing themselves to other people and what they should be doing and not be doing and all of that. So what makes up our self-esteem, and what does a healthy self-esteem look like?
Yeah. So self-esteem is really interesting because it's a fine line between imagining or knowing or feeling that we are good enough and having an inflated self-esteem such that we need to be better than others around us. And inherently, self-esteem isn't about being better than others. It's about believing that we are worthy and that we have some sense of agency and control and mastery in our environment. So the two components of self-esteem are self-mastery, being able to have an effect in the world in the ways that we want, and self-worth. Am I good enough? And like I said, it's not being about better than other people. Mm-hmm. That gets into the realm of sort of narcissism, which we talk about in the book.
Yeah.
But just about feeling a sense of good enoughness. And yeah, I'll pause there.
No, I think that's really cool. So when you're splitting it off into these two categories of self-worth and self-mastery, I feel like one is more self-evident than the other. Self-mastery, let's say I'm a tennis player. Okay, did I win my match? Am I serving at the speed that I want to hit the ball? Am I making these shots? It's very measurable. I can see if I'm getting better. I can improve. I can train harder. But I feel like the self-worth piece is a little bit more complicated. And I'm going to speak anecdotally. For me personally, I feel like I've had a healthy self-esteem. Mm-hmm. But I see it reflected in other people all the time, where they're just down in the dumps for not obvious reasons. But to them, it weighs on them, and it's not. You can't prescribe that. Oh, you're a good enough person. And I'm sure those social connections help. Mm-hmm. But how does someone? I don't even want to use the phraseology of pull themselves out of that. But where do you derive self-worth when you don't have it?
It's a really good question. I think you hit the nail on the head with sometimes we externalize our self-worth. We look to others to validate that we are worthy. I think what we offer in the book, and I think is a healthy alternative to focusing directly on being good enough and proving to ourselves that we're good enough, because it is really hard, is self-compassion, which is treating ourselves with kindness no matter how we're feeling about ourselves in a particular situation. Because self-esteem can be it can feel very contingent upon how well we're objectively doing in life. What happens to my self-esteem when I fail a test, which in med school, a lot of people fail tests. And when I don't have that objective level of success or don't meet my own or others' expectations. So self-compassion is sort of there for us even in times of suffering, and especially in times of suffering. And it's basically, it boils down to treating ourselves like we would treat a friend. It's an action-oriented process of giving ourselves self-kindness, in a sort of a sense of mindfulness, being able to distance ourselves and remain objective in the face of struggles, and recognize that we're part of a shared human experience, that often when we are feeling so low about ourselves or that we are suffering, we're not alone in that suffering, which can be very humanizing. So I think when it comes to feeling low about ourselves, one thing that often there's, that negative internal dialogue that is often our own worst critic saying, you're not good enough. Oh, you should have done this. You were such an idiot when you said this. I can't even believe you said that. So Kristen Neff is like the mother of self-compassion, where a lot of this work comes from. And that negative internal dialogue has been termed by psychologists as mental chatter. And I think one of the best ways to engage with that negative chatter when we're feeling low is just to ask ourselves, what would I say to a dear friend or a loved one, someone who I deeply care about, if they came to me with that same internal dialogue, or if they externalized it to me? And how do I turn that loving kindness that I would so easily and naturally give to someone else inward toward myself? And I think that's just like a quick and dirty way of addressing that question. I actually right now have in my office where I'm seeing my patients have that question, how can I treat myself like I'd treat a best friend today? Because so often we are so harsh on ourselves in ways that we would never dare utter to another person.
It sounds almost like this. The self-worth piece is less about something you feel, and it's more about like a commitment to yourself, or it's something that you do.
So you're saying like action-oriented rather than...
A little bit, yeah. I feel like I've heard other people say similar things to what you're saying. Jordan Peterson says something along the lines of treat yourself like you're like someone you're responsible for taking care of. And I think that's exactly like along the lines of what you're saying. But it's easier said than done, right? You offer this this classical term coined by I think it's Carl Rogers. Unconditional positive regard.
Yeah, that's right.
And do you mind like explaining what that is? Because I feel like if you've never studied it, it's so hard to like, apply that to yourself.
Mm-hmm. It's really hard. And so I want to just put a pin in something you just said, which is that self-worth maybe is sort of action-oriented. It's about treating ourselves. I actually think it's just a basic assumption that we all inherently have self-worth. And that is just by virtue of being human. That is just a basic assumption of our existence, but it's so hard. It's so easy to become disillusioned or disconnected from that. So unconditional positive regard is it's really the notion of allowing others to be who they are and holding space for that and accepting them rather than just trying to change people. I think there's such a tendency, as a human tendency, that we think we can change others. It's an illusion.
Right.
And unconditional positive regard is, I'm not trying, it was developed in the setting of a psychotherapeutic relationship between the psychotherapist and the patient. And I'm not here to change you. I'm here to uplift everything that you are and help you self-actualize and be you and aid you on that journey rather than figuring out all of the ways that we should be changing you. And for me, that's how I interpret the construct.
Yeah, I think that's probably a better place to start, actually, with that just basic assumption that I'm inherently worthy before you even do anything. I like that the way you described your relationship with your patients is that you're not there to change them, that you're simply there to help them self-actualize or become their best self or their true self or whatever the optimal, like,
and their whole self.
Yeah, their whole self.
I think that, best self has like a icky connotation that like
it has like a self-help kind of feel to
it. It's what is the best self? Like what is the best version of us? And I think that's different from an ideal self. I think as long as the concept is something that we're open to evolving over time, because my ideal self today, like who I want to be, if is not going to look the same as my ideal self in 10 years from now or even tomorrow.
Yeah.
So I think some people it can put undue pressure on a person to say what is my best or even what is my ideal self. I think the idea is recognizing we probably all have some values and dreams, and we shouldn't shy away from aspiring or having those dreams for ourselves. And it's also about not beating ourselves up when we might fall short of those ideals, and acknowledging we have a whole life to ebb and flow, and that we are constantly becoming.
I like that. We're constantly becoming. On this path of becoming and then self-actualizing and transcending, you talk about like exploration being really important and like exiting your comfort zone. So how does someone begin to do that when, especially if they've gotten really complacent? Let's say they've endured what they have internalized to be some form of trauma. Their self-esteem is a little rocky. Their relationships are rocky. They're putting those pieces together. But then how do you go out into the world and, explore? How do you do that?
It's really hard. I see so many folks that I work with, one patient in particular who was in my office right before I came here, having a really hard time doing this and getting out of her apartment and engaging with other people. Often when hard things have happened to us, we just want to protect ourselves. We literally want to just keep ourselves safe.
Yeah.
So because we're so threatened and things can be so challenging in our environment, and we've been burned before. So of course you want to, the natural instinct is to just protect ourselves. And how fulfilling is that? How much fun is it to just stay home and be comfortable? It can be really nice for some time, and avoiding stress can actually, what it does is it magnifies our anxiety in the world. When we avoid the things that stress us out and we don't engage with them at all, those mental threats can really build in our minds, and they actually become much scarier to us mentally. So we all have the human drive for exploration. For some people, that gets thwarted when they get hurt or when they are traumatized, and it's the last thing they want to do. And what makes sense to them is to avoid those things. And that completely undermines our ability to grow and get out of that trauma.
So when you're referring to, let's refer to your patient that you were talking about, because I'm not even talking about like exploration in big ways. Like I'm not saying book a ticket and go to some foreign country that you don't know the language. That's like a form of doing that, sure. But you're saying like you can get to a point in life where it's like it's hard to leave these four walls of my house. Mm-hmm. So when you're really down like that, what's like the first small step?
So I think small steps are huge with this to build some distress tolerance. So the first is maybe I try, and I think in the pandemic, so many people have been afraid of leaving their houses to go do basic things like go to the grocery store because for whatever reason. But I think if we can start small, so maybe the first step is going for a walk or going for a drive. The next is maybe it's going inside a store and having to engage with strangers. The next step might be actually going into a place and starting a conversation with a stranger, and thinking about how do I gradually and incrementally increase the dose of what it is that I'm afraid of in a safe way. So, for example, when people are phobic, people have real phobias of spiders. The first thing we might do is show them a video of a spider. Next, we might actually show them a stuffed animal of a spider. Then we might have them actually imagine themselves touching a spider. And we work up gradually to increase their tolerance of that thing that is so scary. Same thing with elevator phobias.
Yeah.
And I think the same is true for these fears that we have in our lives that hinder our sense of exploration.
I think that's profound because, like at the beginning of this conversation, you were talking about humility in sort of looking at ourselves and then moving towards that self-actualization or our ideal self. And when you just look at like the top of the mountain, that's pretty frightening. But if you can just take the first step, I think that's a lot.
And I want to emphasize it's not necessarily like getting through. It doesn't necessarily happen in stages. We can do all of these things simultaneously. And just back to the idea of looking at a mountain, research actually shows that when folks look at the incline of a literal mountain, if they have a friend next to them, it's perceived as less steep.
Really?
Yeah. So I think when it comes to all of this, and I can't emphasize this enough, the power of social support and
Yeah.
connection and relationships to help us through all of this, I think is so huge. And my patient who's having a very hard time leaving her apartment, it kind of all started when she lost her husband and lost her biggest form of social support. And now we're working on helping her get reintegrated with people again, and starting with phone calls and then with walks with people and asking someone on a friend date and actually working her way up to building that foundation, because other people we can't do this alone.
Are there strategies for building that social support? Because I feel as though a lot of people know that maybe the people around them aren't necessarily the best for them, but it's all they have. So I'm not saying go and dump all your friends, because there's merit to having some type of human interaction. But what are the strategies for building that community of people that can really help you like ascend in life?
Yeah, so it's really hard, and different people play different functions in our lives. And I think it's hard to say that any one person is necessarily the person we're going to go to for advice and fun and humor. Different folks play different roles in our lives. I think people are coming at this question from all different angles. Some people are so entirely socially isolated and have literally no one. Some people have a lot of low quality connections in their lives, people that they see and maybe party with and have fun with, but don't necessarily connect with on a deeper level. Some people are so inundated with connections. And I think it's important first to ask the question, where am I? Like, legitimately take inventory. And we have a practice in the book that encourages people to do this. Like, who is in my life? Both who I can connect with, and then who are those people who are really there for me on a deeper level, if anyone. We separate the need for love and the ability to give love as a gift from the need of connection. Those are two distinct needs in our book. And the idea with relationships and social support is the idea that what's most protective is having someone who would be there for us in a time of need. Like, the best form of social support is what's called perceived support. Like, we were looking for help, like knowing that someone would be there.
Okay.
From an existing social support network.
Like, if I got into an accident, the person I would call type thing?
Yeah.
Okay.
And for some people, it may not be like a friend or a neighbor. Maybe it's their physician. Maybe it's a professional in their life. And that's why I think psychotherapy is so important, because for some people, they've, for whatever reason, really alienated themselves from friends, from peers.
Right.
And it's their therapist who have the opportunity to reimagine and reenact how relationships can be. It's an opportunity to practice.
I see.
Being social.
Yeah,
and
how
it's
to
a
structured
engage.
Environment too.
Yeah, so maybe you start off with it's a therapist for, it's someone who there's a dependent relationship with. And then that can be a space to explore how to safely and healthily engage in other types of relationships, like romantic relationships and friendships and neighborly relationships. This
is what scares me about everything being automated. Like, there's something magical about going to a cashier and having that interaction with them, even though they do that 200 times a day and we didn't talk about anything significant. You know what I mean? Is that the difference between love and connection? Was that what you're getting at?
So it's interesting. I mean, so one of my favorite things is when I purchase something at a store where it's like a family-owned business and there is a human being who is excited to sell me something.
Yeah.
And New York still has a lot of these hidden gems. I got a picture framed the other day and I was so happy at my frame store to meet the owner of the store. Like, it was beyond just a transaction. There was a deep connection of understanding the neighborhood, and this person is someone who's deeply proud of his work, and I felt a sense of pride in purchasing something from him.
Yeah.
So yes, automation is scary because it takes that away, and there is no replacement for human connection. So that's connection. So love beyond connection is an orientation toward life. It is the ability to give of ourselves and have an open heart, and not be bogged down in who's in my in group and who's in my out group, and I hate you and I love you, and it's about opening our hearts and having an orientation towards giving of ourselves to others. We don't even really have to we say.
I was going to say, what if I just find you irritating?
That's fine. But why do I find you irritating? What is it about about this person who I find irritating, their lived experience that has caused them to act in a way that isn't compatible with someone who's easy to get along with? And for me, I think one of my strengths in this world, and I think maybe one of my weaknesses, is the ability that I look for the good in people. And often our greatest strengths can be some of our biggest weaknesses. They can also make you blind to things. But
Fair.
I think for me, love and choosing love as an orientation toward life is saying, what is your worth? Even if you really freaking bug me sometimes.
Right.
What is your value, and how do I help you manifest those best qualities that you possess? And that's what I feel like I do with my patients all the time. Yeah. So I think I think we can use those things we don't necessarily like about people to understand how we can put more love into the world and help them manifest the better parts of themselves.
I think the way you said that was so good. And I imagine it was very intentional, because you said the word choose love. You didn't say feel love. And so when you're saying it's an orientation towards the world, I feel like that's like a bit of jargon. It's a decision.
It's so easy and tempting to walk around just fettered by bitterness and see it complaining and having gripes about the world, because there are so many problems.
Yeah.
Choosing to lead with love, and, whether it's to see the positive. I mean, we only have so much attentional capacity. It is a choice. I think it's an easier choice for some than others, just based on genes, based on circumstances, based on all those things we can't choose.
Right, just your predisposition to life.
Totally.
Yeah.
And I think no matter where we are on that, having won the genetic lottery of just how naturally happy we are with that set point, we can all make decisions oriented toward being more loving,
right,
and open, and choosing not to just look to complain about things, and recognizing when we're in that mode.
Yeah. I think the other thing that I sort of drew from what you were saying is that, so I was just joking. I was like, what if I find you irritating? Well, then you reflected that back to me. And it's like, well, what does that say about you? And I think that's interesting that you can look at the world in that way, that the things that irritate you might actually reveal something about yourself.
100%. And it's like, what is this person bringing up in me that I don't particularly like? What is this discomfort feeling that I have? Who are they reminding me of? Who I had a bad experience with? What am I projecting onto the situation? And remembering, there's some people, it's okay that they irritate you. We don't have to deal with them.
That's fine, yeah.
There are other people who we work with, who are in our families, who we can't avoid. There are just some people we can't avoid. And the question is, where do we go? What do we do about those people? How do we choose to see the good? How do we choose to, because often there's so much more that actually connects us than divides us with people.
Agreed.
And we make a lot of assumptions about other people that may or may not be true. And we can't change others. We can really only change ourselves and how we feel. So the question is, am I just going to be bothered by you for the rest of my life? Or am I going to do something about it to transform this connection?
I think that's something, no matter where you are in your life, you can decide to do that. So I think that's more of like a lofty goal, in the sense that you can do that anywhere. But I think you need to orient your life around one thing. Like, you're a clinician. I'm an aspiring clinician. Maybe you're an athlete. And these are like purposes, or higher order purposes. So how do you move from sort of doing all of that self-work, building this community, to sort of choosing these fundamental orientations to life, to then deciding to aim all your intention and energy at like one key thing.
So I actually don't think we should aim all of our attention and energy into one key thing.
Please enlighten me, because
yeah.
I'm young. That's what I'm mentally doing, but is that wrong?
So I won't say it's right or wrong, but I think the best advice I ever got in my life was from my mother, who very early on in my life would always encourage me, just don't put all your eggs in one basket. Because as soon as that one basket collapses, that's your whole existence. And that's what I see a lot with medical students who come to med school. And in order to get to med school, you have to have all these diverse interests and be really well-rounded. And then you come to med school and then are just consumed by this identity of med student and let all those other things become secondary and put all of your energy into, okay, I'm this emerging doctor. And what we find and what I see and observe is that when we let those other parts of our identity, other roles that we play in life, friend, daughter, athlete, musician, when we let those fall by the wayside in service of this one other identity, that's when we lose ourselves. I think what's the most protective thing for me is maintaining these other aspects of my identity so that I, as an individual, as Jordyn Feingold, feel as robust and as connected to all of these purposes that I have so that I can be the best clinician that I can be. But I think if I was focusing all of my attention on just being a clinician and then I had a bad outcome with a patient, or I wouldn't have anything to bolster that identity that is so important to me.
It's funny, as you were saying that, there's this like Warren Buffett quote. You're familiar, he's an investor.
I know Warren Buffett.
Yeah, Warren Buffett. He has this quote that says, like you can put all your eggs in one basket, but just watch it like a hawk. And I think there's some merit to that. Like people make it a long way by focusing on one thing, but then that consumes all their attention and all their time and all their energy. And if you're looking at metrics like contentment or like life satisfaction or well-being, you as a clinician are arguing that you don't get the best outcomes that way.
Well, I think it's like focusing on happiness as a metric or transcendence as an outcome. It's something that emerges when all of these other things are going right in our life. And we have to know ourselves and what gets us going. And certainly if all of our interests are around this one thing, then sure. But I will say, for me, just imagine being in med school, having your full identity as a med student and then failing a test. How will you feel? Like, where does that leave you?
Right.
Whereas if you're like, you know what? I have my soccer practice tonight. I have the ability to go decompress. I have my group of friends who are totally outside of medicine who are going to distract me. I have my family. It's like there are these other things that we have to lift us up and help protect our self-esteem, our ego, that actually will make us better able to then revisit that thing that was really painful and also central to who we are.
Right. Yeah, I think that's definitely really important. Especially as like a young person, you can get really fixated on like one identity, but you're not really just one thing. You're part of a family. Maybe you create your own family. You have your friendships. Maybe you have your interests, and you have a career. And any one of those things, if you were to just categorize yourself as just that, you would be missing parts of yourself. I think that's an important message. So we're just about running out of time, but I think you said a lot of really, really good things that I think especially young people can probably internalize, sit on and use and apply to their own life. I just want to like leave the last like few minutes. Do you have it like any parting thoughts for young people as a psychiatrist that, you know, just things that you see out in the world that like advice you could offer to sort of help people along this, you know, along the idea of like catalyzing an identity and being a whole person, and becoming that ideal self? Like, what type of advice could you offer?
I think life is really hard.
Yeah,
and that we should just expect that. The last few years have shown us like unexpected things happen, and challenges are inevitable. And I don't think the goal of our lives should be to suppress challenge or to imagine that life is just going to be easy for us one day. To figure out what are the ingredients of our lives that have helped us be successful thus far, what helps us feel alive, who do we surround ourselves with that are inspiring to us and help us feel like we are enough, and recognizing that when we don't feel okay, the best thing we can do is just tell another person rather than keep that inside and make us feel like we are the only one experiencing that, because all of us have those thoughts of self-doubt. All of us experience the imposter phenomenon and feeling that, we didn't deserve what we got or and I think the best thing we can do is just have conversations with people and be vulnerable and recognize that we can't go through this life alone. None of us can. We are social creatures, and sometimes we can't solve all of our own problems. We need help. And relationships are everything.
I think relationships are everything. I think that's a great place to end on. Thank you, Dr. Feingold.
Thank you.
So your book comes out September 13th.
Yep.
Choose Growth. Available everywhere?
Everywhere, yeah.
Awesome. Anything else you want to plug?
That's it. You can follow us on social media at Jordyn Feingold and my co-author at Scott Barry Kaufman. And you should listen to his podcast as well, the Psychology Podcast, which is
that's how I found you guys.
Yeah.
Awesome. Thanks for your time.
Thanks.